Trauma. It will touch the lives of 1 out of every 3 Americans, as a traumatic injury can happen to anyone, anywhere, at any time.
If they hadn't taken her by helicopter, she was gone.
They saved my daughter's life.
Every day I see him, it's a miracle. It's a blessing.
Maybe one day it will happen to you and you'll feel the way that other people felt when they were like hurt or injured or something.
In 1988, Palm Beach County voters recognized the importance of a comprehensive trauma system when they approved a referendum that created the healthcare district of Palm Beach County. By May of 1991, the county's trauma system had taken flight, and over the past 21 years has provided life-saving care to more than 51,000 trauma victims.
For the last 20 years, we have been an example for the rest of the state. We were the first to set aside funding to pay for this. We were the first to really come up with a true trauma system. This is a county where from the moment the patient gets injured to the moment that they leave the rehabilitation facility, all the care is coordinated, which is really unbelievable.
Palm Beach County's trauma system is regulated by Florida state law. The county is one of Florida's 19 trauma service areas. The state has designated the 2 verified trauma centers in our service area as St. Mary's Medical Center and Delray Medical Center. Through the healthcare district's model of funding and oversight, trauma patients in Palm Beach County have access to quality care delivered by specialists who are at the ready around the clock. Prior to the state having an organized trauma system in place, there were delays in patient care.
And before that was there, patients lay in the emergency room, sometimes for days, and you just crossed your fingers and hoped that they would survive long enough to be attended by the specialists that they needed.
When someone is traumatically injured, every second counts. 911 is alerted, and EMS, fire rescue, and police are dispatched to the scene. Paramedics provide emergency care and follow standardized treatment and transport protocols created by the healthcare district's trauma agency. If they find that the patient meets trauma alert criteria, the patient is immediately triaged and transported either by ground or flown by one of the healthcare district's 2 Trauma Hawk air ambulances to one of the county's 2 trauma centers, Delray Medical Center to the south and St. Mary's Medical Center to the north. There, a trauma resuscitation team comprised of a trauma surgeon, an anesthesiologist, and other highly trained specialists and trauma-trained nurses await the patient's arrival.
The sooner you provide definitive care, the better the outcome. So that's the golden hour, especially when someone is hemorrhaging or has a traumatic brain injury, especially with the brain. The brain doesn't tolerate, blood loss or lack of oxygen very much.
At the center of this coordinated model of care is the healthcare district's trauma agency, which funds and oversees the trauma system and monitors quality.
The trauma agency actually coordinates all aspects of trauma care, from the injury through transportation of the patient to the trauma center, the trauma care that's delivered, and care after discharge from the trauma center to the rehab centers, as well as discharge home.
Palm Beach County has a very high survival rate. For those patients that arrive at our trauma centers with vital signs, last year we had a 97% survival rate.
One of the things that we forget is not only about saving lives, but it's also about saving disability. Patients get injured and they could end up being very disabled if we don't get to them on time and correct the problem. So a lot of these people, not only do they survive, but they go back to being useful members of our society, and there's no price on that you can't put a price on that.
In 2011, more than 2,800 trauma patients were treated in Palm Beach County's trauma system.
For a long period of time, motor vehicles were the major cause of trauma, and last year falls surpassed motor vehicle crashes as the major cause of trauma in Palm Beach County as well as in the state.
When 78-year-old Providence Balzano fell in 2011, the healthcare district's Trauma Hawk flew her to Delray Medical Center's Trauma Center, where the trauma team performed brain surgery.
When they let me go up, she was in a coma, and they were taking good care of her. I mean, it was amazing.
I miss some of my memory, but otherwise we were doing fine.
Back in 2007, Marvin Crawford was 9 years old and riding a friend's bicycle near his home when he was struck by an SUV.
He sustained an open and a closed head injury. He had 2 broken pelvic bones and a broken arm.
As paramedics treated her son, Marvin's mother, Suzette Morris, feared the worst.
It took them a while to leave the scene because they said they had to stabilize him, but I didn't hear anything, and that was a very scary moment. But then after a while, all I heard was him cry out, and that was the best feeling in the world. I mean, you don't want to see your child hurt, you don't want to hear him crying, but to hear him cry, then I knew that he was alive.
Marvin was in a coma at the trauma center at Delray Medical Center for 13 days. Through rehabilitation, Marvin learned how to walk again.
I think the healthcare district is a great asset to Palm Beach County. I credit them because they made it possible with the funding to have this system in place, to have the doctors and the nurses in place, and to have them available to care for my son when he came here.
Emily O'Keefe was also traumatically injured in 2007. She was just 15 when a car crash left her clinging to life.
It's scary to think what could have happened, and especially if I didn't get here as quickly as I did, or didn't have all these amazing doctors and nurses.
Emily also received life-saving surgery at the trauma center at Delray Medical Center, followed by extensive therapy.
Having a traumatic brain injury has not been easy, but it's her future. She does have a future thanks to the healthcare district of Palm Beach County. But people really do need to understand the hard work that goes into the planning and to being prepared 24/7, because it could be, again, you or your loved one that needs this care.
29-year-old Rob Murphy never thought he would need trauma care until the day he was scuba diving in 2009 and was struck by a boat propeller.
We were surfacing very near the boat that I was on and had a dive flag flying, and another boat came in going pretty fast and came very close to us, and despite our best efforts to try to avoid it, he ran me over and severed both of my legs below the knee.
Rob's friends raced him to shore, where he was airlifted here to the trauma center at St. Mary's Medical Center. Both of his legs had to be amputated below the knee. Weeks of treatment and skin grafts were followed by intense physical therapy and rehab.
About 4 months after everything happened, I started getting fitted for my first prosthetics and was walking first with a walker and then a cane, and then eventually walking on my own within about 5 months.
A local provider custom built and donated to Rob special prosthetic legs designed for scuba diving. He now dives 2 or 3 times a week.
I'd just like to thank everybody that was involved every step of the way. I give them full credit for saving my life, and something I'll never forget. And I'm so grateful to be here and to be alive and still doing what I love.